Okay, good afternoon, everyone. I'm Aaron Ortiz. I am the CEO of La Familia. I am not Vicky Salvatore. No worries, that will be changing soon. I want to welcome everyone to our town hall that we're having around COVID-19. We're going to have a doctor from UCSF joining us a short time, a little bit later, but I definitely want to thank Alameda County Health Care Services Agency for their support, their help in the combat against COVID-19. In addition to that, Alameda County Public Health, all of our partners that have joined us throughout this, battle that we've been dealing with when it comes to COVID-19, such as the Hayward Fire Department, the city of Hayward, and many more partners that we work with. So with that, we're going to get started in just a second, and I'm going to hand it over to our Chief Program Officer, Dr. Carolyn Langsdale.
Hi, everyone. Thank you, Aaron. I'm so happy to be here with everyone, and I'm so grateful for your presence at our town hall this afternoon. So as Aaron mentioned, my name is Carolyn Langsdale. I am the Chief Program Officer here at La Familia and a clinical psychologist. And I wanted to take a moment to talk about two things today. And the first one is to just share a little bit more understanding of where Alameda County stands when it comes to COVID-19 in terms of the seriousness of the spread of the virus here locally. And so in a moment, Vicki will share the website that we're going to use. And I think if you're not familiar with it, many months ago, the state rolled out what they're calling the state blueprint. And so what they're doing with that is they are sending out, they are designating each county at different levels. So they're at purple, red, orange, and yellow, indicating how serious to less serious the spread of COVID-19 is in those areas. And this is the website that I am referring to that Vicky's put up on the screen. Thank you so much for that. And so first we'll take a look at the different levels. And I just want to describe really quickly how that information is determined here. And so you'll see it goes from widespread or the purple tier all the way down to the least serious, meaning minimal, in the yellow tier here. And there are three columns. And in order for a county to be designated in a particular tier, their most severe rating needs to be within that color tier. So I'll walk through that in just a moment. The first column, that's adjusted case rate. And so that is the total number of cases, new cases of COVID-19 per 100,000 residents that have happened in the last 7 days. And so for that, if we're in widespread, that's any more than 7 cases per 100,000 individuals, all the way down to the yellow tier or minimal, where it's 1 daily new case or fewer per 100,000 residents. And so you can see there's a wide range of that. And I'll talk about our statistics in Alameda County in just a moment. The next two columns are about health positivity rate. And so one of them, it's the total number of the average percentage of COVID-19 tests that return a positive result. So if 100 people get a COVID-19 test, how many of them are positive for COVID-19? And the rationale here is that we want to be doing enough testing that we're capturing not just the people who are positive, but we're double checking or we're checking on the people who might be positive. And so a lower percentage of positive rate indicates that we're doing enough testing. And so that's why that's there. So again, more than 8% of the tests we're running are positive for COVID-19. The idea is that we're not doing enough tests, all the way down to less than 2% in the yellow tier. This third column on the right-hand side is about health equity. So that's looking more at about COVID-19 positivity tests in certain populations, and particularly those populations that are more at risk for COVID-19 and they're historically underserved. And so that percentage we also want to see be lower, so not be offset by less at-risk populations. And so that's the framework that the state is using. Towards the end of 2020, we had made it down to an orange tier designation in Alameda County, but because of the surge that we had over the holidays, it went back up again to purple. So Vicki, I'm going to ask you to scroll down to us so we can see Alameda County and where our numbers are at the moment. So you can see the map of the state of California, and you can click on any county, but I'm going to have Vicki click on Alameda County so she can show that. It looks like there's a little bit of a technical issue. So while she's figuring that out, I will read you what I can see here on my screen, even though unfortunately you can't see it just yet. Oh, we might be there. There we go. Okay, excellent. Thank you so much, Vicki, for taking care of that. So as of today, officially, we are in the red tier, which is fantastic news. They redo the tier assignments once a week on Tuesday. So in yesterday's town hall, I was sharing that we were in the purple tier, and today we are in the red tier, which is great news. And what this means is that the most significant of our metrics, of those 3 metrics, that is in the red tier or lower. And so that means that we should be moving in the right direction. So you can see our numbers here. Now, where it says county metrics, and Vicki, I don't know if you can highlight that for us. There are 4 numbers, even though I only talked about 3 metrics. That first number of new COVID-19 cases per day per 100,000, that number is actually not the number we're going to look at when we're thinking about that first column. We're actually going to look at the second number, which is the adjusted case rate. And that's the one that determines which tier we are in, is the adjusted case rate. So that's at 4.8. You can see our positivity rate is at 1.8 and our health equity is at 2.6. So if we keep that up, we may be able, and if we make just a little bit more improvement to our total case rate, we may be able to move down to the orange tier in 2 weeks. Now, that would be a really big feat, and that's what we're hoping for really soon. And we have to stay in the red tier for at least 2 weeks. The link to this website is going to be dropped in the chat. I think it may already have done so. I encourage you to take a look at it so you can get more information, whether you're interested in Alameda County or the surrounding counties. That's information that you can have. Again, it's only updated once per week for the tier designations. So, and that comes out on Tuesdays, and mostly it's only getting reported on when there's a change. So if you don't see a change, then it probably means that we are in the same place. And that does have implications for what businesses can be open or not. So that's one piece. The next thing that I'm going to talk about pretty briefly is just to acknowledge that, during this pandemic, everyone I know, regardless of who they are, what their circumstances are, has been experiencing an increased amount of stress, an increased amount of difficulty. And for many people, that's led to an increase in mental health symptoms and a need for services. And I just want to encourage everyone to reach out for those services if you feel like you or a loved one may need them. And for those of you who are attending, particularly our community members, welcome. You or your loved one may qualify for our mental health services, and we have a variety. If you're interested in finding out whether or not we have a program that would fit your needs, we encourage you to call us at 510-300-3500, and our team will help guide you and to see if you fit within one of our programs, and if you don't, how we can help best direct you to services that would be ideal for you. So with that, I want to thank everyone for their attention, Erin for the time, and hope you all get a lot out of the remainder of this town hall. Thank you.
All right, my clicker isn't working quick enough. Thank you for that, Carolyn. Dr. Carolyn Langsdale, Chief Program Officer for La Familia. With that, we're going to share a special video with you, and I will hand it over to Vicki Salvatore. At La Familia, we know you are the kind of person who wants to be in a good place, to stop scrambling for the money you need to get your needs, to stop feeling so stressed every day. The problem is that in the face of COVID-19, everything got turned upside down. Money you used to count on, services that were important to you, even schools closed. It got so much harder. We understand what it feels like to hang on by your fingertips. We get it. La Familia has been around for 40 years. We started because a small group of people believed that we could have more if we came together, if we raised our voices, if we made sure that people who look like us and sound like us, Black people, brown people, disabled people, people who can't afford to lose even a little, have a seat at the table and get what they need. People should not have to lose their dignity to get what they need. We believe you deserve more. Nosotros creemos que tú debes de tener más, more support, more money, more stability, more calm.
That's why we are standing with you during COVID-19. We are moving our services online, keeping you safe, and finding money and partnerships to get you what you need. We're helping you make sure you have food and connecting you to money for rent. When things look really bleak, we run a homeless shelter so you and your kids stay together, even in the worst of times. And we're helping you to know it's okay not to be okay. Our counselors are here talking to people and parents who feel the weight of COVID-19, who are afraid that this much stress could undo the things that are still good in your life. We are helping you get unemployment insurance, stimulus checks, and if you aren't eligible for those things, we're helping you get money from places like the Hayward Family Support Grant. And when you have to work because there's no other choice, we're helping you find jobs.
We believe you deserve more, and we will walk beside you to help you get it. Connect with La Familia, and we will help you get your basic needs met to make sure that you and your children don't have to struggle alone with stress, depression, or addiction. We will help you when you are ready to raise your voice and to champion what's fair. We can't know how long this is going to last, but we can stay connected and make sure that you come out of it in a better place. You belong here. Eso es lo que significa vivir la familia. That's what it means to live la familia. Okay, thank you for that video. Now what I'm going to do is I'm going to share a presentation with everyone here at this town hall. And right after that, we're going to go into an interview with a doctor from UCSF. Thank you. Hopefully everybody can see my screen here. So La Familia Equity through Health. First of all, for those of you who may not be part of La Familia or have received services from us, La Familia has been providing services here in Alameda County for 45 years. These are some of the services that we provide. We provide both clinical and family empowerment services. I won't get into the details of that, but what I can tell you is, especially in the last year now that we've had COVID-19, we've definitely been doing a lot of work in this area, and also with the need for behavioral health services. So those have been a lot of areas of service, along with reentry, along with child and adolescent school-based programs that we've done in a way of telehealth and so on. But I don't want to get into the details of the programs. Those, please feel free to call us at 510-300-3500 if you have any questions. Now, what I do want to let everyone know here is that these are the current testing sites that we have here in South County. I'd like to send a big thank you to Turcio Vasquez, La Clínica, and Native American, along with other partners that we've had when it comes to testing, and now going into vaccination, which I'll lead to in a bit. So in South County, specifically the Tri-City area, Fremont, Newark, Union City, these are the testing sites that if you go to the COVID-19 Alameda County website, you're going to find that provide testing currently, okay? So both in Fremont and Union City as well. Now, let's see here. Now further, there's also testing here in the Hayward area, where Glad Tidings is providing it for the community, La Familia as well. We have 3 sites, one on Mission, that's in the Cherryland, Ashland unincorporated areas, another that's at Eden United Church of Christ, which is also, of course, the Cherryland unincorporated areas, and also our partnership with the Hayward Fire Department through SkyWest, which again, we've vaccinated over, between both of our sites, or I should say all 3 of our sites, over 80,000 people up to this point. Now, when it comes to COVID-19, as of yesterday, there are a total of 1,293 deaths in Alameda County. Deaths that include Latino are 280, Asians 223, African Americans, and it's in Spanish, my apologies, 211, a little mixed up sentence there. And those who have not disclosed race are 87. In Alameda County, a total of 78,000 people have tested positive for COVID-19 as of yesterday. Now, when it comes to vaccines, in Alameda County, 119,000 have taken the first vaccine. When it comes to the second, 28,554 have taken the second dose. So this means theoretically, or factually, I should say, only 28,000 people as of yesterday are fully vaccinated. Now, the numbers may be off a little bit, give or take, between yesterday and today. I'm sure they're a little bit different. And hopefully there's been a ton of people that have been vaccinated for their second vaccine. Keep in mind that every day this is being, this model and these statistics are being upgraded. The county upgrades it, I believe, I want to say every week or so. So it's pretty accurate and solid information that you're going to get. Now, when it comes to the mega sites, we have 2 mega sites here in Alameda County. One of them is at the Oakland Coliseum and also at the Pleasanton Fairgrounds. So for those who have received codes in the past or have been part of organizations that are getting the vaccine, that's how you've known about the mega sites and been able to receive the vaccine there. What Cal OES is also doing, along with FEMA, is putting community pods together, along with other community pods that the county is doing through Alameda County Health Services Agency and Alameda County Public Health, of course. So I'll talk a little bit about both. When it comes to Cal OES and FEMA, what they've done is really work with community service agencies like La Familia and also faith-based organizations as well. So we've seen this happen a lot in the last 2 weeks or so, both in Oakland, in the unincorporated areas, which La Familia has operated, and in Hayward, and specifically South Hayward. One of those was Glad Tidings this weekend, which did a fantastic job. That said, the county is also doing their own community pods, which have been fantastic. I know there's one in Oakland out of Fremont High School, and they've done great work in making sure that the community that needs the vaccine gets the vaccine, and those who cannot necessarily go or don't feel comfortable going to the Coliseum or one of the mega sites can go to one of these community pods by and from the county to get the vaccine. La Familia will be providing vaccines. As of, I want to say yesterday, we have vaccine over 2,000 people when we started last week with the partnership that we have, but also La Familia will be doing its own vaccines. So we will be providing that, and we're preparing for that as we speak, both at our Cherryland and our SkyWest site. So we're getting the wheels turning, we're working on it. We have received the systems that we need to start it, and we're there. What we're concerned about, as always, supply and demand. I think that's what we've seen all over the news. We know that the feds, the state, the county, they're working on it, and we trust that as they get more vaccine, we can get more vaccine and make sure that the community and those that are most in need can get it in the respective community versus other areas where they may not feel comfortable. So with that, we look forward to working with you. Please be on the lookout for us. We look forward to providing the vaccine, and we look forward to getting back to normal. Thank you. And we will be transitioning on next to our doctor that's going to be here from UCSF. So Vicki, I'm going to ask that you put on some super cool music that you had on a little bit earlier as we transition to our doctor.
Hello.
Pleasure to have you here with us.
Thank you. Pleasure to be here.
So we're going to go ahead and start the interview with you, Dr. Klein. I know that we have till 5:30, so I want to put that out there to the members from the community that are joining us, and we'll go ahead and get started. So, Dr. Klein, before we start, thank you so much for being here with La Familia. Thank you so much for dedicating your time today. We know you're extremely busy, but one of the first things is if you can just give us a little bit of background about yourself as we dive into the fun questions when it comes to COVID-19.
Sure. I am an emergency room physician. I've been working at San Francisco General Hospital for about 20 years. I'm trained in both emergency medicine and pediatrics. I'm also in my own community. I've been volunteering at the our mass vaccination site at our Civic Center, and have been giving lots of these talks around the country, actually, to just give people good information and answer their questions about COVID. And I do have a few slides. If we just, I think that might answer some questions if we want to do that before the Q&A.
100%, 100%. I get a little ahead of myself, so my apologies.
That's okay. Shall I go ahead and share my screen to show those slides?
Yes, please.
All right. Great. Can you see my slides here? Perfect.
Yes.
Okay. So as I said, my name is Judy Klein, and I work at San Francisco General Hospital. I'm going to talk to you about the now 3 COVID-19 vaccines that are available to us all here in the United States. 2 of these are very similar and have been around for a little bit, the Pfizer and the Moderna. The Johnson & Johnson is a little different, and this is the one that was just approved about 10 days ago. The important thing to remember, though, about all of these vaccines is that they are all highly effective in preventing hospitalization and death from COVID-19. And that's really, coming from an emergency department, I'll tell you, that's what we're really, really wanting from the vaccines, and these vaccines deliver. So the first 2 vaccines, the Pfizer and the Moderna, the Pfizer, both of them involve 2 shots. You get 1 shot for the Pfizer, you wait 21 days, and then you get a second shot. The thing about the Pfizer is it requires deep cold storage, so it can be difficult for places that are remote to give this vaccine. The Moderna vaccine, you get 1 shot, you wait about 4 weeks, and then you get a second shot, and this shot can be kept in a regular refrigerator. Now, the way that both of these vaccines work is that we take a little bit of the genetic information from the coronavirus, and this is what encodes for the spike protein, that thing that makes the virus kind of look like a halo. They wrap it in a layer of fat, and then that is then injected into your muscle cell. The muscle cell take this information and use that genetic information in order to start making that spike protein, which then appears on the surface of the muscle cell. Your immune system then recognizes this spike as something that shouldn't be there, and it starts to make antibodies to destroy the spike. Now, it's really important to remember 2 things. 1, you cannot get COVID from this spike alone. You need the whole virus. The spike alone pretty much does nothing other than stimulate our immune system. And thing that's important to remember is that this little piece of genetic information degrades actually pretty quickly in our body. So it will not stay with us. In the future, if the COVID virus then tries to infect you, your immune system is ready and can attack the virus and kill it before it makes you sick. Now, how well did these mRNA vaccines, the Pfizer and Moderna, work? Well, so this is data from the Pfizer trial that included, if you see, 20,000 people got the real vaccine, 20,000 people more or less got no vaccine, and they compared and looked at how many people in each group got COVID. And what they found is over the next couple of months after vaccination, well, there were only 8 cases of COVID among people who got the vaccine and 162 cases of COVID among people who didn't, which translates to that effectiveness that we've seen around of 95% in preventing symptomatic COVID disease. And so that is amazing. In the Moderna trial, the Moderna vaccine showed very similar results in a 30,000 person trial. The Johnson & Johnson vaccine is a little different because it's only 1 shot, making it easy to give. It's 1 shot and done. And it can also be stored in a regular refrigerator. It uses a very well-established mechanism using an inactivated cold virus that cannot make you sick. Essentially, it's very similar. A little bit of genetic information comes out of the virus. We put it, comes out of the COVID. This is what makes the spike protein. We put it in this inactivated cold virus. It's absolutely harmless and cannot make you sick. Goes into your muscle cell. Your muscle cell then starts to make the spike protein again. And once again, that triggers your immune system. The really important thing to remember, once again, is that the spike protein alone cannot make you sick, cannot give you COVID. Neither can this cold virus that's used to introduce the spike protein information into your muscle cell. Now, what do we know about safety from the Pfizer and Moderna vaccines? Well, what we know, and I can verify that these symptoms occur. With the first shot, it's really common to get some sore arm. This is your immune system working, essentially. With the second shot, it's now your immune system has already seen the spike protein. It becomes a little bit more active. And what your immune system does is it gives you these symptoms of fatigue, headache, even low-grade fever. And this lasts for about a day or a day and a half. And this, as I mentioned, is really a marker that your immune system is working. For most of these people, as I mentioned, symptoms did not last very long, didn't interfere with daily activities, but about a third of people felt like they didn't want to go to work the next day. Allergic reactions are extremely rare. 4 to 5 cases out of every 1 million people who got the vaccine got an allergic reaction, and all of them recovered just fine. In terms of the Johnson & Johnson, once again, large trial in 8 countries, lots of variants in these trials. This trial was done later than the Pfizer and Moderna vaccines, and really similar symptoms: soreness in the arm, headaches, some tiredness, and very few allergic reactions. How well does the Johnson & Johnson vaccine work? Because I'm sure you've read about this in the newspapers. It works very well. It isn't as effective against sort of mild or moderate disease. We're talking about like runny nose, cough, low-grade fever, only about 72% effective, but it was extremely effective in preventing hospitalization and death, the same really as the Pfizer and the Moderna vaccines. And it's really not, very difficult to compare the 2 studies because the Johnson & Johnson, as I mentioned, was done later. And so it included a lot of these new variants and was still extremely effective in preventing hospitalization and death, okay? So the net message is whatever vaccine you're offered, you should take it because they're all really effective. What we know is that COVID vaccines work very well. That's true in older people, men and women, across all age groups, young, old, across various races and ethnicities. So it worked just as well in African-American people, in Hispanic people, and Asian people, and Pacific Islanders. All of them were really well protected. It worked very well in people who were at high risk because of medical conditions, obesity, high blood pressure, diabetes, HIV. As I mentioned, side effects do occur, but they're usually very well tolerated. And at this point, we're actually way more than 40 million people vaccinated. We're probably up more in the 70 to 80 million range, and there are no reported deaths. That's really important. What we've also learned recently, and this is really exciting, everybody's always been worried like, well, okay, so these vaccines prevent getting COVID with symptoms, but what about COVID without symptoms? COVID without symptoms, we worry, can we transmit it to other people? Even if we're vaccinated, are we still at risk of infecting our grandparents or our families? And we now have information that from looking at healthcare workers in England and data from Israel, that there's almost a 90% reduction in the amount of COVID without symptoms after you get the vaccine. That means that if that your likelihood of transmitting to somebody else after you've gotten the vaccine goes down dramatically. So that is really, really good. And even though this is all data, we're using the Pfizer vaccine, the Moderna technology is so similar that we expect that it's about the same if you get the Moderna vaccine. What we don't know yet is whether or not there'll be rare, immediate, or long-term side effects. That being said, every vaccine that has ever been developed has always shown its most important and significant side effects within the first 2 months. And we're way beyond that and just haven't seen much. What about pregnancy or other immunological diseases? Pregnant women were not included in these studies, but women did become pregnant during the studies, and they did absolutely fine, as did their babies. And we also know that we give a lot of other vaccines to pregnant women because pregnant women are often at higher risk, and that's true with COVID. They're at higher risk of severe disease. So the recommendation now from the major organizations, medical organizations that deal with pregnant women, say that pregnant women should talk to their doctor, but it is likely better for them to get the vaccine than not. What about kids? Unfortunately, kids, the vaccine has not been approved for anyone under 16, but kids are now being studied. The Pfizer and Moderna studies on kids are now being done down to the age of 12, soon down to the age of 5. So more information about that in the coming months. How long will protection last or whether we'll need booster shots, we just don't know yet. We're looking at that right now. So when making a decision about the vaccine, whether it's right for you, ask yourself, are you exposed to the virus in your work or at home? Are you personally at risk for serious disease because you're older, you have high blood pressure or diabetes, obesity, a heart problem, or an immune system problem? Or do you interact or live with someone who is at high risk for serious disease? How much has this pandemic impacted your life? These are all important considerations. And then balancing your concerns about getting the disease versus these vaccine side effects, which I think overall, for the vast majority of people, are pretty mild. Now, an important thing to remember is 1 to 2 weeks after you get both vaccines, you will be nearly completely protected from serious COVID disease, hospitalization, and death. And your life will change. I can attest to that. You can start to socialize normally with other vaccinated people and even low-risk unvaccinated people, according to the new guidelines. But your interactions with non-vaccinated people, like out in public and in larger groups, initially are not going to change entirely. It'll still be important to mask, make sure you're in well-ventilated spaces and distance. But as more and more people get vaccinated, the virus will die out to a low enough level that we'll get what's called herd immunity. And really, that's what's going to bring us back to a normal life. I personally got the Pfizer vaccine back in December. I work in the emergency department, so I'm exposed to people with COVID every day that I'm at work. The biggest reason I got the vaccine is that I felt it was really important for me to be able to continue to work to help my patients. And it was important for me not to bring the virus home to my family. I wanted to keep them safe. And I also want to make it possible for my child to go to school in person. And in my community, that's now happening. With my first dose, this one, I got a bit of a sore arm. With the second dose, I got some chills and fatigue. It lasted a day, and then it went away. And as I mentioned, I am currently working in my own community to vaccinate people and to answer questions about the vaccines. A couple things I wanted to point out is the vaccine is free. It's being paid for by the federal government. It doesn't matter what your legal status is. No, there will be no questions at all about documentation status. In fact, it's illegal to share information from vaccination sites with ICE. And then, as I mentioned before, this is really one of the important tools. We're now, the state of California is really trying to vaccinate everyone in all 58 counties. And the way you find out about how to get the vaccine and whether it's your turn is to either go to this website, covid19.ca.gov, or directly to myturn.ca.gov, and you can sign up. You'll get informed when it's your turn to get the vaccine, and you can make your vaccine appointment straight online. And with that, I will stop sharing and answer any questions that anyone may have.
Dr. Klein, thank you again. Thank you for that presentation. What I'm going to do first is ask the community that has joined us, if you can please put all your questions and answers in the Q&A box and not in the chat box, but I will make sure that I acknowledge any questions that were in the chat box, and hopefully I can capture them all. So the first one, Dr. Klein, does it matter if you felt no symptoms when receiving the second dose?
It's very, very variable. You know, when I said that probably about 50% of people had symptoms, that means the other 50% didn't. It's just everybody's immune system is a little bit different. So not to worry if you didn't have symptoms.
Got it. And in the Q&A, is it safe to travel out of the country after getting the COVID-19 vaccine?
Well, that's a complex question. So in terms of safety for the person who's now fully vaccinating meaning 2 weeks after you get the last dose of your vaccine, you are safe from hospitalization and death. The question is, what's going on in the country you are going to. There is a very, very low risk that you could pass along disease, but in a lot of places in the world, the healthcare infrastructure is really challenged. There's also all kinds of restrictions, testing and such. But in terms of personal safety, you are definitely almost completely protected from hospitalization and death. So not promoting it, but there we go.
So the next question is the vaccine number reported for Alameda County, those delivered through county and not including the others. So meaning, I know that I gave stats on our COVID-19 website for Alameda County on how many people had received the first dose and second dose. And the question is does that include everybody that has taken the vaccine, including those who may have Kaiser or Sutter or any other medical plan? Do you want to take that, Dr. Klein, or do you want?
Well, not really. I don't live in Alameda County. Perhaps you can.
So what I can say about that, everyone, is that all vaccines taken have to be registered with the state. So whether you're part of Sutter or Kaiser or on Medi-Cal or uninsured, it is all counted and inclusive. So the next question on Facebook, because this is on Facebook Live, Dr. Klein, those who choose not to take any vaccine, will there be any restrictions?
I can say that there currently are absolutely not. Our both state government, county governments, federal government are trying to encourage people to get vaccinated. There's no requirement to be vaccinated. What the future holds, I don't know. So with regards to schools, people's jobs, I don't know. And I don't know that anybody could answer that question right now. We're at this point just trying to vaccinate as many people as we can and get to the point of herd immunity where we have enough people vaccinated that the virus starts to die out. And hopefully we don't have to get to the point of, saying anybody has to get vaccinated who doesn't want to. But that being said, I am encouraging people to do so.
Thank you. Do I need a vaccination if I haven't been sick with the flu or COVID-19?
So as I said, I think, I would recommend that everybody get vaccinated. Certainly we're vaccinating people kind of in order of who's at highest risk, which is why we started with healthcare workers and older folks. And now we're moving down to frontline workers, teachers, agricultural workers and such. But ultimately, in order for us to get to the point where the virus really dies out because it doesn't have anybody to multiply in, we need to vaccinate a lot of our population. And so I would say as many people as we can get vaccinated with the COVID vaccine and frankly, the flu vaccine, the better.
Dr. Klein, is it fair to say, when that question is being asked, that, it's not only about protecting yourself, but about others around you, because you may not know how COVID-19 may impact them, in particular, those of age, those who may have diabetes or high blood pressure?
I think that's a wonderful point, and thank you for making that. I feel like we're not just getting, I think if you're, 80 years old, you're primarily getting vaccinated for your own safety. When we're getting down into groups that are less at risk personally for serious disease, we're vaccinating ourselves for our community. to protect those around us who may, in fact, get very sick if they get the disease. And so I think that's an excellent way to think about it, that this is something we are doing for our whole community, taking the vaccine.
Thank you. What is known about the new variants and the 3 vaccines?
We know that, I'll start with the Johnson & Johnson because it was the one the studies were done most recently. We know that the Johnson & Johnson vaccine is extremely effective against severe COVID. That means COVID that puts you in the hospital or takes your life, even with all of these new variants, because the Johnson & Johnson vaccine was tested in South Africa and Brazil, all around the world, with all these variants circulating, and it was extremely effective. So far, the studies that are looking at whether people who are vaccinated with the Pfizer and Moderna vaccines are finding that they're still very well protected against all of the variants. And we're getting a lot of this information from studies in Israel. They have vaccinated a large segment of their population. All those variants are still circulating, and the vaccine has still been extremely protective against severe disease, hospitalization, and death. So I would say quite effective.
Thank you. And the next question, does the vaccine protect against new variants? Was pretty much the more or less the same question.
Mm-hmm.
The following is, what is your input about receiving the vaccine if you have a chronic disease such as cancer and are under treatment such as chemotherapy?
That's a great question. My first statement always is you should talk to your doctor if you're undergoing chemotherapy about getting the vaccines. That being said, I personally have vaccinated quite a number of people who were in the midst of chemotherapy. Because what we worry about with the vaccine and people getting chemotherapy is not that it's dangerous for them. It's not dangerous for them. It may be, though, that their immune system is so compromised that they won't react well to the vaccine. They won't get a vigorous enough immune response, so it won't work as well for them. Sometimes, maybe a doctor will say, let's wait a couple weeks until your immune system is better and you may react better. React more strongly. Your immune system may be able to react more strongly to the vaccine. But the reality is those are exactly the people that are at highest risk for the disease, for getting severe COVID. So, most cancer doctors that I have talked to are really encouraging their patients to get vaccinated as soon as possible, as soon as they're offered the vaccine.
For sure. And, for the group that may not have been here yesterday, I know that for me, it was a particular concern in my own family, when it comes to my mother. And, I checked with her to make sure it was okay to share with everyone. And that said, she's 83 years old, high blood pressure, diabetes. And the doctor that I went to, which I'm sure Dr. Klein, was Dr. Fernandez,
Mm-hmm.
and asked her if she should take it. And she definitely said, yes, 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 yes. And after I got my 10 yeses, I felt comfortable. We waited in 3 hours in line, and she got vaccinated. So she's had both vaccines since she was fully vaccinated, and one step at a time. So she's been good, in good spirits. We even talked to each other, and she said, I even feel I can breathe better. Like I can breathe better. So that's so the next question, should I continue to get COVID-19 tested if I've had my first Pfizer vaccine shot? And also, what about after I've had both shots? Should I continue to get tested?
So the current recommendation is that once you've had your 2 weeks after your second vaccine, or in the case of the Johnson & Johnson, your first vaccine, you should reserve testing if you get symptoms. Okay, the whole testing after having contacts with people who have had COVID probably can go away after you're 2 weeks past your last vaccine. Until that point, you should just you should get tested as you would have before if you have close contact with someone with COVID or you personally have symptoms.
Thank you. And the following question, is it normal that the vaccine causes a rash in the skin after some days?
I have heard that the rash is can be a side effect. It's only in a minority of people, and once again, typically only lasts for a few days. But that has happened with some people.
So I'm going to ask the next question, but I definitely want to ask a follow-up to this question. So the question is, how long will it protect me? Will I have to get a COVID-19 shot every year?
Excellent question, and I cannot answer that question. That's an excellent question. We just don't know. When any vaccine is developed, the people from the original studies and now the entire parts of the entire population will continue to be studied to look to see how long their immune response stays with them. How long does their immunity to COVID, stay strong? And if it looks like their immunity is getting less, or these variants are getting through, then we may need a booster. Maybe it'll be like the flu shot, that we'll need a new one every year. We just really don't know, but time will tell.
So I'm going to go off script for a quick second and ask you some questions that I'm curious about, Dr. Klein.
Sure, absolutely.
As a society and us being in this for a year, I'm wondering why we're not having the question about this being an endemic and this being with us long term. Is it something that doctors are a little bit concerned about to maybe be the first one to say that, or in addition to that, to be concerned about what people may think about when it comes to this? Because if we're really looking at it through an endemic lens, that means that it's with us long term. That means that we know we're going to have to take the vaccine every year. But I also know that we're very early on with this, pandemic, COVID-19. So.
Yeah, that's a great question. And I assure you that at least within the medical community, we are most definitely having those conversations about whether or not this is just, I think most infectious disease specialists will say this is something that's going to be like the flu. We're probably going to be dealing with this for a long time. And hopefully that conversation, as you're suggesting, will get out into the public space, into the media space, so that people start to get accustomed to the fact that it may very well be that this is, we always say that if it gets down to the level of a yearly flu, then we've then the vaccine has done its job. It's not killing 500,000 people in our country every year. It just brings us down to a virus level that's like the flu. That's probably where we're going to end up being, where it's going to be something like every year, or every few years maybe you're going to have to get a booster, and it'll be something like with the flu, that we should be mindful that we don't go to work sick, we don't go to school sick, hopefully it'll change that behavior among people. We wash our hands really well. And maybe in the future, it'll actually reduce the amount of flu we have in the world too, because we'll start sort of not feeling like we have to plug through our lives, even when we're sick. It'll be acceptable to not go to work or school when you're sick. So.
Thank you for that, Dr. Klein. I also want to be mindful of time. I know we only have four more minutes. What we're going to do for everyone we can't get to is we'll summarize the questions, Dr. Klein. We'll send them to you. Sure. And then if you can respond to those, then we'll send it out to the community that's joined us. So let me go back to the questions here and I'll get to all that I can. I think this one was asked a little bit earlier, but I'll ask it again. Those who choose, and this is from Facebook, those who choose not to take any of the vaccines, will there be any restrictions? I think you answered, we just don't know yet. Is that correct?
Correct. We don't know yet.
Okay.
Not yet.
Not yet. We're getting there, hopefully. So the next question is, do construction workers qualify for the COVID-19 vaccine right now?
You know, every county is different. Every community is different. Probably if you go up to smaller towns around the country that are vaccinating larger segments of their population, maybe so. I would say probably in the Bay Area, not yet, unless you qualify based on your age. Frontline workers are considered essentially grocery store workers, food service workers, educators, people working in agricultural sectors, and obviously police, firefighters, healthcare workers, but not quite construction workers yet in the Bay Area.
And promotores. Here in Alameda County, they're under Tier 1A. So is it still recommended to double mask if we have already received both doses of the vaccine?
I'm going to go out on a limb here and say no. Okay. I think that if you've received both doses, you're 2 weeks past both doses, a single mask worn in public is plenty when you're in, like indoor spaces, grocery stores, etc.
And the next question is, will there be a time when we don't have to wear a mask? I'm fully vaccinated, but how do I know when will it be safe? How do I know when it will be safe?
What a great question. And I'm going to say yes, there will be a time in the near future when we don't have to wear masks. Right now, if you're fully vaccinated 2 weeks past your last dose, you can absolutely socialize indoors with other vaccinated people without masks, okay? In fact, if you are completely vaccinated, you can also socialize with one family that is unvaccinated, as long as those people are low risk for severe disease. So that means, not somebody who's got cancer or heart or lung disease, and you do not need to wear a mask in that setting. That is the recommendation from the CDC. But in terms of not wearing masks in the future, when out in public, I think that day is near. It will happen when we get enough people vaccinated, that we achieve that herd immunity where the virus really dies down to a very low level. And that's what we're trying to achieve.
Thank you, Dr. Klein. I know we have a ton more questions. I'm going to ask one more and then we'll email you the rest. And Dr. Klein, I can't thank you enough. It's an honor, it's a privilege to have you here with us. We would love to have you come back, even with a bigger community,
Sure.
because hearing from you, I mean, any doctor from UCSF that is doing this work, y'all need to be on CNN, be on every single channel, just educating people, because that's what we need. We want to hear from the experts and we want to know what's going on. So thank you. So let me take the last question. How do we know what the long-term impact is of the vaccine?
So that's a great question. And of course, these vaccines, the first ones were only approved in December after a few months of study. And so now we're 4 months past then. So we essentially have 6 months only of information. And so far, everything's looked good. In terms of beyond that, obviously we don't know. But that being said, every other vaccine that that's ever been created in this country, all the major side effects were seen within the first 2 months. So we don't expect that there's going to be any significant long-term effects based on that experience. Anything that we haven't already seen, and what we've seen so far is that they're very safe vaccines.
Dr. Klein, thank you again. We look forward to having you back. So I'm going to get you on the hook so you can come back to us in the next month or so, because this is extremely valuable here in Alameda County, to keep getting the word out there to folks that just don't have access to information like this. So thank you. We look forward to having everybody joining us again, and we'll be talking to you soon. Thank you, Dr. Klein.
Happy to come back. My pleasure. Thank you so much, Erin.
Appreciate you. Thank you.
Bye-bye now.
Bye-bye.